Mr. Ashiji. Firstly, I am indebted to Dr. Shankar Gowda to organize this CME, Continuous Medical Education, in Davangere. And also, thank you to Mr. Kumar and all other dignitaries, particularly principals of different medical colleges, and also doctors, and also pharmacists, and the press reporters. See, necessity is the mother of invention. If you take the history, Leonardo da Vinci, and he never studied any medical science. And in 15th century AD, 16th, he was in 1915, 49 or so. He was a great surgeon and also great painter and also great structural designer also. So like that. Now I would like to tell you that what actually is my imagination and vision to show to the world that what is the power of our Ayurveda, which is having the history of more than 5,000 years. If you go through the factory, then you can understand. Generally, Ayurveda means the mindset of the people is in some small place, it is being packed by the people without using any mechanized these things, are getting packed by some loan licensed factory like that. Because here, my confidence, how it has been translated into the factory to give the entire world, can just put me for 2 3 minutes. That when the existing medical science, whether it is allopathy or homeopathy or Unani or Ayurveda or any science, when it is not working, when it is not giving any relief to the patients, then they are coming forward to us. Because last time, I think about 20 days back, one gentleman from US, he has asked me, sir, in US, after spending lot of money, then they are coming to the alternative solutions, that's Ayurveda. Here also, if you do not give proper treatment, then what the Americans will going to think on our Ayurveda. So now, we have studied on you and how you have developed these supplements or medicines. As per the new guidelines, all these ingredients have been called as supplements only, health supplements. And we will take up this project to US. Like that group have actually given the statement on this. See now, before explaining how actually it's working, I wanted to ask you people what actually you are thinking on this. If you ask some questions, so it's very easy for me to deliver accordingly. Whether it is see now, yesterday morning at 6:45, the premier, he has been considered as a 36th richest man in the country. Mr. Rakesh Junjunwala was died because of diabetic nephropathy. Because of diabetes, he had a CKD, he was under dialysis, and thereafter he had a cardiac arrest, he was died. His age is, my age is same. And now, you doctors are all like, angels. What the District AYUSH Officer, Mr. Shankar Gowda has told that if the proper person takes the research work to the humanity, so it's having its own value. See now, if the medical colleges, if the doctors could have been practiced in Bombay, I think Rakesh Jinjirovaji definitely could have not been died. As we know that our body is having the capacity to retain Atma, that is the soul, for 120 years to 150 years. The biggest problem is we do not know what to eat, what not to eat. In the outset remark, Dr. Shankar Gowda has said very clearly, the food is a medicine. As we know that Charaka Samhita clearly states that Ahari Mahaushad, Ahari Sharif, Shariri Aha. What we eat, accordingly our body is. Once if we follow the proper food, and once we eradicate synthetic compounds which are killing the cells internally, then automatically you can enjoy the life like anything. And secondly, I don't know how far you are going to react for my statement. Firstly, we should get rid of all the problems. We should be in 100% healthy. We should only take the food as a medicine, not other than the food. So then we can express to others also. Similarly, as what I have developed the sciences, wherever the existing medical science is not giving relief. The best example is, I am telling you, stroke. When there is a dead tissue in the brain, there is no science in the world to eradicate that. In some cases, there is some operation by opening the skull, but the adverse effects is so many. Many people have spent more than 60 to 70 lakhs and there is no results. Ultimately, they came to me and they are getting extraordinary results. Just afternoon, Mr. Ashif has told me that, sir, that the executive of Airtel, his father had a bell palsy. That because of the stroke in the face, almost our portion is like that. And he is having a very good relief for only within a month like that. Then I told him, no, I want to speak with the patient only. Because as a researcher, always I am thinking, how speedily, what way that patient has got the results. Then he has connected. I asked only one question. Tell me, what percentage of the relief you have within a month? He said that 30%. I am extremely happy on that. Similarly, yesterday only, I took one testimonial. I have shown to Dr. Srikanth Ji, the principal of Tapovan, when morning I went to there for flag hoisting ceremony as well as to deliver lecture to the students and the faculty. That gentleman was a retired officer from KPTCL. Wife had a brain stroke. She was on coma. After taking my treatment protocol, third day she had opened her eyes and thereafter started moving her body. And the fourth day or fifth day, she started consuming food orally through the mouth. Earlier they used to induce through the food pipe. And now she could be able to speak little bit. So this is the power of our Ayurveda. So now I want to give in a very differently today's lecture that you ask me, because generally some representatives will come from the company and they give the lecture. But here it is in a very peculiar case. The inventor himself is here. For more than 170 diseases, you take psoriasis, you take thyroid problem, you take arrhythmia, there is abdominal outfitting, if you take directed cardiomyopathy, if you take chronic kidney disease, whether it is from the diabetes or whether it is from the BP, or if you take osteoarthritis, osteoporosis, or if you take the liver cirrhosis, even the INR level is more than 2.5 also. Our Ayurveda is having such a capacity that within a month you will see the resultant effect. Similarly, if you take pancreatitis, if there is amyloidosis more than 800, the existing medical science says that there is no any alternative to take care of that patient. He has to be given certain things as long as he lives. So in this way, I have brought this science that Ayurveda in a very different manner. As I am telling you that Honorable Prime Minister Shri Narendra Modi sir few years back he has stated that why Ayurveda is not popular. Of course, now it is not so. Enormous changes it has been taken place since 2015. It was that lecture was 2015. It seems to be. He has stated that there is no standardization in dosage and administration, and there is no efficacy like allopathy, and there is no world-class packaging. Just now, I am so happy to give the remark by our Dr. Shankar Gowda ji that sir, now the bottles are very different color. Earlier it used to be in one color. So people used to get confused. So thereafter when Mr. Vivek ji came into our company as an advisor, then he has noticed it and ultimately it has been changed. And now when in chronic diabetes, as DUS was explaining, that when there is a toes burning, when there is no sensation below knee, when there is a diabetic retinopathy, the eyes are getting blurred, and when there is a diabetic neuropathy, he cannot walk. You cannot believe the professors in the head of the department of different allopathic medical colleges, they are sending their parents to me. See, that is the power of Ayurveda. The only thing what I did is, I have strongly recommended yoga and diet, along with the herbal compounds. And in every disease, I have defined it, what to take, what not to take. I am thankful to IAS service, wherein we used to write and craft a number of drafts for the different schemes and all. So when you are drafting, you should understand that if you become common man, how you can perceive. So similarly, I have defined each and everything for this one. So now, my point is, if you could ask some questions, accordingly if I give, the lecture, I can finish up within 15 minutes, 20 minutes. Then it will be very nice to have, interactive session. So because so many senior most doctors are here, so if they ask the questions, it will be nice to answer and accordingly I can give the lecture. Kindly, the question given, I will stop. Okay, this is basically cell regeneration process in dysfunctional organs. So now, can you show me that photo, that cell? This is basically cell is the body. Cell cannot be seen. The group of cells is a tissue, group of tissue is organ, and group of organs is our system. So we are having more than 78 organs. And now, different organs or different cells are required different types of nutrients. Only our gut microbes knows that which type of enzymes has to be get released to act as a catalyst to separate a particular nutrients from the nature gifted food. In the food, everything is there. So that's why in Ayurveda also it says that, because I don't know the shloka, that if your gut, stomach is good, the whole body will be number one. So we are actually damaging the gut microbes. So gut microbes are in 10 times of the cells, and which knows which enzyme has to be important to which organ to separate that particular nutrients. Now existing medical science only identified few nutrients like vitamin C. It was actually invented in 1950s by University of Birmingham, where my son, who has just now you have seen, he only came out from the acute megalecemia, that's a blood cancer. So where in the launch I was seeing the Nobel laureates list. So in this one gentleman in 50s only, he has actually done the research on vitamin C. See, now in the COVID, you know that how much vitamin C tablets has been consumed through tablet format and through the naturals, there's orange and pineapple, etc. So like that. Now I will give you another example. Calcium is the nutrient for protecting the bones and joints. That everybody knows it. Why? When there is the osteoarthritis, when there is a C4-C5 gap, that is cervical spondylosis, when there is a L4-L5 bulge, why calcium supplements are not going to be cured? So that means God has kept other than calcium also, which we do not know. In my treatment, Honorable MP from Davangere, his relative, I think few months back he came and he was explaining, sir, I am related to Honorable MP sir, and he is my relative, and my father-in-law had cervical spondylosis and he was bedridden through your medications. He is now living independently without anybody's support. So how it has been acted? There is no magic. Only what I did is, I made me trigger that particular beneficial microbes in the gut system to release that particular nutrients to supplement for the bones and joints disorders. So that means, why now liver cirrhosis? Now, in liver cirrhosis, when MNC hospital states that it's over if you do not get liver transplanted. So as you know that liver transplant cost is between 28 lakhs to 60 lakhs. And that gentleman is from a number of cases are there. I'm just giving you some examples from Bidar. And he came to my chamber with the support of his brother and wife, and totally stomach was swollen, water was there. And ultimately he said that all the reports he has given to me stating that we are not afford to spend more than 38 or 40 lakhs to eat. That estimation was given by the hospital, and we wanted to take your treatment. I said that if your mouth is keep control, I always speak in a very elegantly, just to make him to follow the diet. 100% he will be alright. You believe me or not, after 3 months he came down and he went to the hospital, got the report, and doctor stated that now your liver is working properly, no need to go for the liver transplant like that. Then he came to me and showed me and given the testimony with all the documents. This is the power of our Ayurveda. So therein I have not done any magic. Maybe this our ancient herbal compounds acting as a nutrients to the cells, or maybe it's acting as a prebiotic to the microbes. Prebiotic means, as you know, that food for the microbes which are in the gut system. So otherwise it's not possible. Now here Mr. Kumar is there. Afterwards he may going to explain how the Kumar had the health issue, and after getting up that health issue, he has started promoting to others to help. So like that. And myasthenia gravis, as you know that is a neuromuscular disorder which will slowly block your food pipe, and slowly it will block your speech also. And that gentleman used to take the treatment from Nimans, Somehow he came to us. His name is Srinivas. You cannot imagine. Within 2 months, more than 70% he got recovered. And thereafter, he has started his own clinic by taking the doctor from Ramnagar. He is from Ramnagar. And now he is 100% alright. So like that, when any organs which are not dysfunctional, this Ayurveda with yoga and diet, 100% it will get functional. And another example I am telling you from Bhadravati. The lady had vaginal wall cancer. When they went to the hospital, the doctors have stated that why you are unnecessarily going for chemo, stating that it's a waste of money like that. They said, no, we want to take. So, aligned with my treatment protocol, they took the treatment, and after 2 months, the PET scan was negative. When they showed to the doctor, doctors were not able to, imagine. They have stated that, I think you have taken something, some other medications also. Otherwise, it is not that much of, fast result in allopathy. Like that, the doctors have told to her. This was given by there only. They have given a very clear statement that how actually the interactions was taken place between the doctor and patient. So that is the power about Ayurveda. Where, see now also, you just see that they will go to all sciences, then ultimately they are coming to the Ayurveda science. And if you ask, any patient, 99% like that. Because there is a kahavati in Hindi, Gar ka murgi dal ka barabar. So whatever there in the house, it is not tasty. The same food taken to other house and stated that it is prepared by that house, that family. They think that what a beautiful taste. And then they will ask that you see that it has to be prepared in that manner like that. So that is the mindset of our people. But still, anyway, after COVID, as he said that whatever we take, garlic, ginger, soaked methi, there's a fenugreek seed, raw vegetable juice, all these things will act like statins and blood thinners, as well as it will act as a nutrients to different cells. See, like that, the nourishment is very important. That is the one thing. Second one is regulating the cellular metabolic activity and cellular respiratory system. So here in flax diet, abundant ligaments are there which will detox the cell. It is a Dr. Johanna Barbic theory from Germany. And omega-3, omega-6, it will regulate the cellular metabolic activity and cellular respiratory system. Thirdly, as I told you, metabolic activity, second part, first part is the nourishment, third part is the detoxification of the cell. That's called Panchakarma, what we are doing in Ayurveda. But Panchakarma cannot be performed to all the ages. And it cannot be performed regularly. If it is a regular means it is very expensive also. But whereas here in flax diet, the ligaments will take care for the Panchakarma. So if the healthy person, if he takes the flax diet at least once in every day as a first course of the food, he will not at all going to get any cancer problem or heart attack or brain stroke. And other persons who are having different ailments 2 times, but for cancer I am recommending 3 times, because basically Dr. Johanna Barbic developed this flax diet for the cancer patients only. So in this way, this is basically cell regeneration in the dysfunctional organ, the principles of treatment. And when any ailment is there, one can see the resultant effect 3 days to 1 month. If there is a gastric problem, 5 minutes to 1 hour. And I am mentioning you one beautiful words from your colleague, Dr. Guru Basuraju from JSS Medical College from Mysore. He stated some few years back, "Sir, really I am thankful to you. You have developed such a medicine for gastric problem, which even we do not have in Ayurveda like the PS Express. Express is actives. Because we cannot tell it will cure as per the Magical Remedies Act. But in Ayurveda, the principles of treatment with the yoga and diet, any disorders will cure and regenerate the organs. So this is what I want to say. So now if at all any questions are there, just ask me, and I don't want to waste your precious evening time. And firstly, you see that your health should be 100%, Pakka. No health disorder should have any doctors or pharmacists, whoever be in this, CME. Secondly, your family members should not have any problem. So then you will have an authority to explain and tell about my, self-regeneration process to others. So thank you very much. Please ask me any questions if at all you are having in your mind. Carry another questions. In heart, I am telling you, the oldest art institute in India is National Art Institute in Delhi, and wherein one patient, he was suffering from angina for the last 25 years, even after angioplasty and open heart surgery. But after my medications through one Dr. Sharma ji, is the second commanding person in that hospital, cardiologist. Within a week, he got, that such a way that totally angina has disappeared. Such a way it works. Only the thing is they have to follow that diet. Patya Mata Yoga, that is very, very important. Even then it works. But still, my humble request is, food is the medicine. And one should not take lifetime whatever I have developed. Even if they want to take, there is no problem, because this is purely 100% herbal extracts. And secondly, as per the recent guidelines, which were issued in 2016 by Ministry of Health and Family Affairs, Government of India, that all the herbs which have been defined in Drugs and Cosmetic Control, Schedule 1 have been notified as the health supplements. Because these health supplements we are taking since generations. So it doesn't have any harmful. Whether you take Arjuna, Neem, or whatever it is, so it's all good for our body. So, the question that came, otherwise you can start,
Yes, go to the next one.
And if you want to see the testimonials, it will be in the website miraclebrings.in. Or else if you want to see one testimonial, you can see. So thereafter we'll find out.
Which one?
You will show that that IRS officers had multiple problems. Heart problem, diabetes problem, and diabetic neuropathy, retinopathy, and stroke also.